Okay, guys, we're going to do a quick discussion about ABO blood typing. At the end of the video, you should be able to analyze blood types and explain the significance of their interaction with one another and how you should be able to analyze them to prevent injury or disease. So first, we're going to review a couple of terms. I have listed here the major formed elements or cells that are found in blood: erythrocytes, leukocytes, and thrombocytes. Erythrocytes are simply the red blood cells. Their job is to carry oxygen. We have leukocytes. These are your white blood cells. Their job is to serve in immune function, so they fight disease. They kill pathogens like bacteria and viruses and parasites. Then thrombocytes, which are commonly known as platelets, their job is to release clotting factors. So they allow for your blood to clot when you have injury to a blood vessel. And then these two things, these are really important for the blood typing. We have two sets of proteins. Antigens are proteins that are on the surface of the red blood cells. So I'm going to abbreviate red blood cells as RBCs. But if we want to be anatomically correct, we're going to call them erythrocytes. And then antibodies, these are proteins that actually circulate in the blood plasma. So these antibodies circulate in the fluid that surrounds the blood cells. So this system, ABO blood typing, focuses on the erythrocytes, the antigens, and the antibodies. So what we're going to do is do a visual of each of these. Pause. So we're going to draw a couple of pictures to illustrate how this whole thing works. So basically, the easiest way to remember is the job of the antigen is to act as an identifier. So those proteins are on the surface of the red blood cells, and they act just like a name tag. If a certain antigen is present, then that identifies red blood cells for that person or for any potential pathogens that cell is that type. So the system, the ABO blood typing system, is formulated based on the presence of two antigens first, an A antigen or a B antigen. There's this additional antigen that is called the Rh antigen, and that antigen is just a separate protein. There is a specific interaction, but we'll talk about that later. Right now we're going to focus on the A and the B. So we have 4 blood types, so let's do 4 quick illustrations. So I'm going to draw this. This is supposed to be my red blood cells. These are going to be my red blood cells. So for the first one, I'm going to mark this one. Again, these become like name tags. If it's present on the surface of the red blood cell, that determines what type of blood you have. So I'm going to do this. And then I'm going to do this. So again, these are the name tags, the antigens. This person with these 2 antigens, and we drew these with different shapes because the proteins have different shapes. So the structure is different. That makes the function of the protein different. So this blood type would be blood type A. This person has both the A antigen and the B antigen. So this person is blood type AB. This person's red blood cells has no antigens at all. So this person has blood type O. And then over here, this person has only B antigens present. This person has blood type B. So that takes care of the antigens. So those are the little name tags. They determine what type of blood you have. Now, the antibodies, these are sets of proteins that help to protect your cells from other invading cells. So if you are blood type A, you have antibodies that circulate around in the plasma outside of all of your blood cells to help protect your body cells. A person will have the opposite type antibody versus the antigen that they have. So in the case of a person who's blood type A, they are going to have anti-B antibodies because, ladies and gentlemen, they're going to have they're going to have anti-B type antibodies because their job is to protect this A cell from things that are not like it. Things that are not like it are those things that have B antigens. So it has anti-B antibodies. Does that make sense? Yes. Question? Any questions? Okay. So in the case of this person who has blood type AB, they have both B antigens and A antigens. So guess what? They have no antibodies at all. They welcome everybody. We don't need anybody to protect us from anything that looks different. There's nothing that no other cell has that it does not have. So it has no antibodies. A person with blood type O will have both anti-A and anti-B antibodies because they don't have any antigens at all. So floating around in the plasma, there's anti-B and anti-A. They want to protect, the antibodies want to protect these cells from anything that has any other antigens. That means if it has an A antigen, like this cell, we have anti-A to protect it from these cells. If you have B antigens, like this cell, you have anti-B to protect the cell from that. Because those cells don't look like this, that's abnormal to the body. Over here on this side, for a person who has B, they have anti-A antibodies. Again, what's normal for them are type B antigens. So they want to protect this cell from anything that has type A antigens. So we have type A antibodies. Does that make sense? Yes? So this is how this looks. So if I was to introduce little blood cells that are type B or blood cells that are type AB to a person who has blood type A, these anti-B antibodies actually will seek out those cells that are marked with B antigens. The anti-B will identify the B antigens on this B cell, and then it will attack those cells, and it will cause the cells to stick together in clumps. That's called agglutination. So this clumping of your blood, of course your blood can't be clumped, because if your blood clumped, then it can't flow, and then you'll die, essentially. Anti-B, so this blood type that's AB, this cell still has B antigen, same thing, we'll identify that, it will attack it, and then the clumping will occur. So this person can receive A, this person can receive O, because they're not marked with B antigens. Does that make sense? Over here, a person with AB, they have no antibodies. So that means that they can receive all blood. Even if you have B antigens, that's okay. There's no anti-B antibodies. If they get A blood, that's okay because there's no anti-A antibodies floating around their plasma. AB is the universal recipient. It can receive all blood types. For a person who is O, they can only receive O. That's all they can get. Person has anti-B. This person has anti-A. This person has anti-A and anti-B. So they can't receive from anyone. They only can receive from O. And then over here would be that this person can receive B. They cannot receive A. They cannot receive AB. This O that has no antigens, a person with blood type B can receive. That makes O the universal donor. It can be given to everybody. So that takes us through, and that looks a little confusing, but that takes us through how the antigens and antibodies interact. This last antigen, called the Rh antigen, is this additional factor. It is present on the surface of some red blood cells and not on others. If it is present on the surface of a cell, then we're going to say that this person is now B positive. If it's absent on the surface of the cell, that person is now O negative.